Now let's go to the New South Wales COVID figures, which have just been released for the previous 24-hour period, and the numbers have shot up yet again. 2,213 new cases with one more death. 215 people are in hospital, so that is over the last couple of days we've started to see an increase in the number of people in hospital in New South Wales. It was about 152 days ago, now up to 215, but the number in ICU is sticking at around the same level in the 20s, 24 people in ICU. So just to put it in a bit of context, what's happening with the numbers, this is yesterday's, because today's figures have only just come out. We haven't had time to put that on the graph just yet, but this shows you what's been happening with those case numbers in New South Wales since it got on top of the Delta outbreak several weeks ago. Case numbers had been bubbling along at about 100 to 300 a day for several weeks. Then a little over a week ago, they started jumping up into the 400s and 500s. And over the last 4 days, they've just shot up exponentially. And so today, it's literally off the chart. More than 2,200 cases. Yesterday's number in the 1,700s was the biggest that New South Wales had seen so far. And so that number today in the 2,200s obviously blows that out of the water. It's important to keep in mind that authorities say that they're confident that the hospital system is prepared for whatever this wave is going to throw at us. And we've seen, to date, we've only seen a gradual increase in the number of people in hospital. And we'll see how that evolves over the coming weeks, with there being a lag, generally being a lag in terms of hospitalisations compared to case numbers increasing exponentially. And New South Wales Health has placed hospitals on red alert because of concerns about the Omicron variant. Reporter Manos Anguri joins us now from Sydney. Manos, firstly, I just mentioned the basics in relation to the figures, but take us through them in a bit more detail.
Good morning, Joe. Yes, so another day of record-breaking case numbers today. As you mentioned, 2,213 new cases. It is important to mention, though, that our testing numbers in the past couple of days also have been very significant. Overnight, we had 127,000 testing numbers, which is really high. I think a lot of people are getting tested ahead of the Christmas period to have that peace of mind before they attend big social gatherings, which is a very responsible thing to do. In terms of our hospitalisation, it has increased overnight, but not at an alarming rate. Currently, we have 215 people in hospital and 24 people in ICU. And our vaccination rates still stand at 94.8% of the eligible population who have had one dose, and 93.3% are now fully vaccinated. For those case numbers, we don't have a breakdown just yet, but we are expecting a large portion of those to be in the Hunter, New England region. And we are expecting to get an update later on in terms of how many Omicron cases we've confirmed overnight as well. As of yesterday, the state has confirmed 122 total cases of Omicron.
Manos, a red alert has been issued for hospitals in New South Wales. What does that actually mean?
Well, that means that only people who are essential visitors or compassionate visitors are allowed in hospital. These visitors do have to be fully vaccinated, and they also have to wear masks. And there are exemptions for this rule, but exceptions will be made on a case-by-case basis. Now, New South Wales Health have said that they haven't made this decision lightly, but extra precautions need to be taken to ensure vulnerable people in hospital are being kept safe. The government is also encouraging people to continue wearing masks, even though now masks are not essential in most places.
And you mentioned earlier that there were a number of cases in the Hunter region just to the north of Sydney. Just take us through exactly what's happened there and this chain of transmission that started from that boat party on Sydney Harbour.
Yeah, well, one of the latest venues of concern is actually here in Sydney. New South Wales Health is trying to track down 600 people who were at a Taylor Swift-themed party on Friday night. Currently, 97 people who were at that event have tested positive to COVID, and anyone else who was there is considered a close contact. They have to get tested immediately and self-isolate. And yes, as you mentioned, this follows a number of super-spreading events in Newcastle after a man went to the boat party in Sydney Harbour, skipped isolation and went to that nightclub in Newcastle. He's now been fined $10,000. And a new venue of concern has also been announced in Newcastle. It's the Great Northern Hotel. That is now a venue of concern. So anyone who was there on Saturday, 11th of December, are considered close contacts. And New South Wales Health have said that at least 50 cases of COVID are linked to that particular venue. So with all these super spreader events in New South Wales, a lot in Newcastle and now in Sydney as well, it's very likely that case numbers in New South Wales will continue to grow very rapidly.
And Manos, is that Manly that you're at there this morning? And what's, just for people outside New South Wales, what's the sense that you're getting from people in New South Wales as these case numbers rise significantly? I mean, we've been warned that this was going to happen, but authorities saying that they're prepared for it.
Yeah, I mean, I'm at Manly, like you mentioned. There is a lot of people around early this morning, and not a lot of them are wearing masks. Of course, this is an outdoor setting, so it's not required. But I think there is some concern because of these rising case numbers. But like you mentioned, this is something we were expecting, especially with the easing of restrictions that have taken place. Like I mentioned, in terms of testing, even yesterday I was nearby the office. There was testing clinic there, and lines were going all through the road. And I've heard that other places, testing clinics are also in high demand. So a lot of people are getting tested, which is good news. It's a very responsible thing to do ahead of Christmas, but it is quite disappointing that this is happening just before the Christmas period. But I think the best thing we can do right now is take caution and be as careful as we can.
Yep, okay, Manos and Guru reporting there from Sydney.